Just hit record.
Wonderful. All righty. So can you give me a thumbs up that you can see my purple slide?
I see it.
Wonderful. Okay. All righty. So, um, as Morgan mentioned, we're going to be talking about mental wellness strategies for caregivers. I'm joining you today as a representative of the Mental Health Association of Maryland. And MHAMD has been around for over 100 years, and they are an education and advocacy organization dedicated to helping Marylanders to understand how their brains work and advocating for policies and procedures at the state level and trickle down that help to improve our mental health and general well-being in lots of different capacities. So I want to invite you to check out the website mhamd.org if you're interested in learning more. All right, so for our time together today, we are going to be talking about strategies for mental wellness for caregivers. And our particular objectives is we're going to learn about self-care and why it's necessary. We're going to discuss different self-care strategies, and we're going to, give you some ideas for planning your own self-care toolkits, which I want to invite you to build and put together outside of this workshop today. So, when I say self-care toolkits, what I'm referring to are items, strategies, ways to calm down our brains and our bodies, and to promote our own well-being throughout the day. And we know as caregivers, when we promote our own well-being, right, we are helping to promote the well-being of the person that we're caring for. So you'll see throughout the presentation a couple of slides inviting us to consider an opportunity for physical items that could help to promote wellness throughout the day. And I'll name those as we come to them. But I also want to invite you, as we go through, um, to just jot down any particular strategies that you really identify with or like. Or if you have an idea hearing about one of the strategies of like, oh, I, really enjoy this fuzzy blanket. Maybe I should put that in my toolkit. Whatever it may be, I want to invite you to, jot those things down for yourself as well. And so when I say toolkit, what do I mean? I mean, it can look a little different for everyone based on what your preferences are. For me, I have a kind of toolkit list written on my phone in the notes section. And when I'm having a bad day, I'll just pull up that list. And it has some strategies that I can use in the moment in order to help myself feel better. It could also look like a physical toolkit. Maybe you have a nice box or a bag, and you would prefer to have just a bin of physical items that you can reach into and pull out in order to promote well-being. And we'll talk about what some of those items can look like as well. But it's up to you as to what the toolkit looks like. Do what's useful for you and what you're most likely to use and benefit from. All right, so what is self-care and why is it necessary? I am very excited to talk about this topic with you because this was one of the most impactful things that I learned about my own brain and how to manage my own stress and well-being. So, cortisol is the stress hormone. It is designed to let us know when we are in danger. It shows up in our brains and in our bodies. And it really puts us on high alert, makes us ready to act, fight, flight, freeze, that response. And it's a protective measure in our bodies. Way back when we would be walking through the jungle and a tiger would show up, cortisol would really put our bodies into the mode to uh, get out of there or fight back or do what we need to do to protect ourselves. And then when the tiger went away, our cortisol levels would go down. Now, today, cortisol looks a little bit different. And because cortisol looks a little different, we all react to cortisol a little bit differently. It may not look like a tiger anymore. Although if you do have a tiger around, I bet you're feeling cortisol. Um, but it may look like, oftentimes when I ask folks what causes cortisol in your system, they'll say the news. Or maybe they'll say a particular person's name, or commuting, or perhaps a injury or something they're dealing with personally. But there are so many different things that cause stress in our lives, and oftentimes those stressful things stick around. And so our cortisol levels don't have an opportunity to go down. And so it really becomes up to us to take an active role in managing our cortisol levels when that stress hangs around. Because if we don't, we can actually become ill. Um, when our stress levels are too high, we can experience things like fatigue, moodiness, muscle tension, or pain, physical pain in our bodies. We may have trouble sleeping. Some of us may overeat. Some of us may not eat enough. We may feel angry or irritable or overwhelmed. Sometimes we may use alcohol or drugs to feel better. We may have an inability to relax, and all of these things could cause changes in relationships as well. Now, it's important to note as well traumatic stress, because there's cortisol in the everyday sense that I've mentioned. And then there's traumatic stress. And, this is typically related to a traumatic event, such as a pandemic or, a car accident. The list goes on and on as to what could cause someone to feel trauma. And it's important to note that what is traumatic for one person may not be for another. Two people can live through the same exact car accident and have very different lingering outcomes. One person may be afraid to get in a car and not want to drive for a while. The other person may get in their car the next day to go to work and not think anything of it. Um, that being said, it's natural. It's normal to experience symptoms for a few weeks after a dangerous event. In the example of the car accident, I don't feel comfortable being in a car or driving for a few weeks after the accident. That's perfectly normal. Um, it's when those symptoms last for more than a month and seriously affect our ability to function that they may be something more serious called post-traumatic stress disorder, or PTSD. And I don't say that to scare anyone. I say that to give you hope that if that is something that you're identifying with, um, it is treatable, right? PTSD is treatable. Some symptoms of PTSD can include flashbacks, bad dreams, scary thoughts, avoiding places, events, objects related to the traumatic event, being easily startled or feeling tense or on edge, having difficulty sleeping, avoiding thoughts or feelings related to the traumatic event, angry outbursts, experiencing negative thoughts about yourself or the world, distorted feelings like guilt or blame, and a loss of interest in activities that you previously enjoyed. So, if you are identifying with any of these symptoms or thinking of someone who does, like I said, there is hope. I don't bring this up to scare you. PTSD is treatable. And there are tons of professionals who are trained, particularly in working with trauma, that can help to walk someone through the steps in order to recover. So, the first steps in seeking help, if you're worried about yourself or someone else, a great place to start is just by talking to someone. Oftentimes, it's easiest for us to talk to people that we trust. So, this could be a friend or a family member, maybe your spiritual counselor, your doctor. They don't have to be a mental health professional. You can talk to your primary care doctor about it. Your neighbor, too, and anyone in your circles that you trust, just to start the conversation and get yourself used to talking about it, too, can be very helpful. In terms of seeking help, I mentioned your primary care doctor can be a great place to start because oftentimes they can refer. If they aren't able to provide the help themselves, they can be a listening ear up front and they can help to refer you to someone that they know of who can help. If you're currently working, your employer's HR department or employee assistance program may have resources. You can also contact your insurance provider directly. I often recommend this because it is uh, kind of the one of the easiest ways to make sure that you are finding a provider within your network is to contact your insurance provider directly. Oftentimes, there's a phone number on the back of your insurance card that you can call and talk to someone about what you're looking for. The Baltimore County Mental Health Authority is also a great place to go. The phone number is on the screen. I'll read it aloud. It's 410 887 3828. And they have a list of all of the licensed mental health providers throughout the Baltimore County area. And they also know which ones accept Medicare, Medicaid, um, things like that. So they are a great resource as well. And the SAMHSA Mental Health Treatment Facility Locator. Perhaps you're someone who wants to browse a computer list instead of make a phone call. This may be a good option for you. And SAMHSA's resources are available in English and Spanish. Now, if you or someone you know is experiencing a mental health crisis. Now that is defined as a time of intense difficulty, trouble, or danger. You don't feel like yourself. Perhaps you are experiencing really disruptive behavior, aggressive or threatening behaviors, or even thoughts, um, self-injurious thoughts or behaviors, um, suicidal thoughts or behaviors, threats to harm yourself or others, right? These can be external or these could be internal, maybe just thoughts that you're really struggling with right now. 988 is the place to call. And you can type it into your phone just like you call 911. It's 988. And they are the Lifeline hotline for Maryland and for every state now uh, that recently developed in the past couple years. So this is a great place to go if you are feeling like you're in crisis, or maybe it's just 1 a.m. and you really need someone to talk to and you're not feeling this bad, but it's 1 a.m. and you want to talk to someone. Call them up. Call them up. There'll be a care and call specialist on the other end that will just meet you where you're at, hear you, and listen to whatever you'd like to talk to them about. If you're looking for resources, they'll try to connect you with them. Um, and yeah, so this is a wonderful resource that I want to make sure that everyone is aware of. Mental Health America writes that the COVID-19 pandemic has had a profound impact on the mental health of folks of all ages. Now, more than ever, it's critical to reduce the stigma around mental health struggles because that stigma often prevents folks from seeking help. So, one of the good things to come out of the COVID-19 pandemic is that we're talking about the brain. We're talking about mental health. And a lot of us are talking about it more openly than we did before the pandemic kind of uh, humbled us. um, so, I am excited to share with you some of the brain science around stress in the moment now. And then we'll talk about some strategies that we can use to manage these cortisol levels. So, the amygdala hijack. Obviously, we're talking about something called the amygdala. And the amygdala is part of the brain, it's a particular region in the brain. And stimuli, things that we encounter in our daily life, are processed through the parts of our brain called the amygdala and the hippocampus. And you can see the different areas in the illustration here on the right. The hippocampus is responsible for storing memories, automatic and implicit reactions, both positive and negative. The amygdala is responsible for regulating our emotions and behavioral response, and it's connected to our flight or fight response. So, the amygdala is involved in detecting threats, triggering a body's response, such as pulling our hand off a hot stove. You don't think about it, it just kind of happens. That's the amygdala at work. It's also active in fear conditioning, such as that example of being afraid to get in a car after a car accident. That's the amygdala trying to protect us. The amygdala is involved in processing positive emotions and encoding our emotional memories. So the term amygdala hijack is something that was coined by Daniel Goldman in his 1995 book called Emotional Intelligence. And there are two elements of an emotional hijack. One is an intense emotional and physical reaction, and that the reactions are out of proportion to the circumstance that we are encountering. So what does this look like, practically speaking? This looks like sometimes road rage, right? The screaming and shouting and cursing that we may experience in the moment of a car cutting us off may really not be that warranted. We may be overreacting. Saying something you didn't mean in the heat of an argument can be an example of the amygdala hijack. Or perhaps on the flip side, on the good side, maybe you win the lottery, and in your excitement, you scream and cause such a scene in the grocery store. That's the amygdala hijack, kind of sweeping you away in that emotion. Maybe you lose a tennis match, and in your frustration, you throw the racket across the court. I can say for myself, when I was a little girl, I had very long hair, and I remember brushing it, and my hairbrush got caught in my hair in a knot. And it felt like I spent half an hour at least trying to get this hairbrush out of my hair. And I don't know if it was actually that long, but after a while I got so frustrated, I ripped the hairbrush out of my hair and I threw it across the room. An example of amygdala hijack. And it can also show up, maybe you've been trying to open a can for 5 minutes and you get so frustrated and angry, you slam it on the counter. All of these intense emotional, physical reactions that are out of proportion to the circumstance, these are amygdala hijack moments. And it's natural. It is natural. We all, I think, get swept up in these moments. And, particularly through the lens of caregiving or in any relationships, right? These moments are often not our proudest moments. And so it's very important that we are able to identify when they're happening, and we can help calm down our amygdalas so the outcome becomes different. Physically, in these moments, we may be shaking, our blood pressure increases, our heart's racing, our becomes faster, our muscles tense, or maybe we feel a bit nauseous. So, why does reason go away in these moments? Where does it go? What happens? Research from 2016 suggests that when the amygdala is activated, the prefrontal cortex, the part of our brain that's responsible for impulse control and rational thought, it's actually less activated. When the amygdala is activated, the prefrontal cortex is less online. And if we are experiencing stress in that moment, if cortisol is present or maybe is present from earlier in the day, and if we're drinking alcohol, then that makes the prefrontal cortex even more offline, or even harder to hear. I like to think of it as a volume switch. The volume on that prefrontal cortex is turned down. So it may be sitting there saying, this isn't a good idea, but it's not the loudest thing talking, the amygdala is. Like I said, the good news is we can learn to recognize when the amygdala hijack is happening. We can calm down our amygdala, which will control the amount of cortisol in our system and keep us thinking clearly. So I am excited to share with you a lot of different strategies now that can help us to calm down our amygdalas, both in those moments, right? The amygdala hijack, but also that can help us to control our cortisol levels throughout the day, even if we're not experiencing an amygdala hijack. One of my favorite exercises is grounding through the senses. And, I think about it with uh, 5 fingers and 5 senses, right? So you start out, and I want to invite everyone to do this now. Look around the room around you and acknowledge 5 things that you can see. And Don't just glance at it and look on to the next one. Like actually pause and name it in your mind as specifically as possible. So for myself, when I look up, I see a white wall. Now, I want to be a little more specific. I want to notice the scuff on the white wall, right? Because the more specific we are, the more our brain needs to slow itself down and push through that amygdala hijack to the prefrontal cortex, and it helps us to calm down. So I want to invite you look around, acknowledge 5 things you can see around you as specifically as possible. Now acknowledge 4 things that you can touch around you, 4 things you can feel. Again, as specifically as possible. 3 things that you can hear. Now, this could be external sounds, it could also be internal. Maybe you hear your belly make a noise or your heart beating. Just note 3 things that you can hear. 2 things that you can smell. And if you need to move a little bit to find a scent, feel free to do so. And 1 thing that you can taste. What does the inside of your mouth taste like right now? Now, this exercise, I find and I've gotten feedback that it's very helpful at bringing down our anxiety level and helping to calm down that amygdala in those moments. Now, if you're someone who experiences anxiety, or you find your physical sensations of amygdala hijack overwhelming, then it can be helpful to focus on things outside of the body um, as you go through the senses. So instead of noting your heartbeat, perhaps note the comfort of the couch or the floor underneath your feet. Um, if you're someone who experiences anxiety, that kind of external sensing can really be the ticket to make sure that this is as effective as possible for you. Alrighty. So some self-care strategies. I love this quote. It reads, "Now and then it's good to pause in our pursuit of happiness and just be happy." Mindfulness is a great tool for that. Mindfulness is a state of focus on the present moment while calmly acknowledging and accepting our feelings, thoughts, and bodily sensations. Mindfulness includes a number of elements. Awareness. This involves tuning into what's happening in the present moment, just like that exercise we just did with the senses. So we just practiced awareness. Mindfulness also includes focus, paying attention to the present moment without thinking about the past or the future. And that is where, in that exercise we just did, I advise that we describe as specifically as possible. That's where the focus piece comes in. It really makes us stop and focus on the things that we are experiencing when we need to list and explain them specifically. Acceptance is another element, accepting whatever you may be thinking or feeling without judgment or trying to change it or your reactions. Now, that takes practice. And that's why I advised if, you know, for whatever reason, bodily sensations are overwhelming, acceptance takes practice, and revisiting that and practicing may help to get to the point where acceptance is possible. But if you're not there yet, that's fine. Focus on the external. And lastly, observation. Recognizing unpleasant sensations, thoughts, and feelings is temporary, and observing them objectively without reaction or judgment. So these are the four elements of mindfulness. And I love this quote from Norman Lear. I feel like it is a wonderful illustration of mindfulness. Norman Lear writes, "When something is over, it's over, and you're on to next, whatever next happens to be." I thought if there was a hammock in the middle of those two words, that would be the best definition I know of living in the moment. Now, mindfulness, I'm sure we've all heard of mindfulness before, and I'm here to tell you there's actually some science behind why it's good for us. Um, s- Science and research is telling us that mindfulness helps to reduce our stress, those cortisol levels. And as I mentioned before, stress can have serious effects on our physical health and our mental health. And so by practicing mindfulness, we can help to lessen those cortisol levels. And this can have health benefits such as lowering blood pressure and strengthening the immune system, since those are both things that are impacted by high cortisol levels. Mindfulness can also help to improve our mood, and it may reduce symptoms of mental health conditions such as depression and anxiety. It is shown to improve brain function and, namely, our ability to focus. Over time, as well, meditation can sharpen our memory and improve our mental performance. And a really exciting piece of research is telling us that mindfulness actually helps us to cope with pain better, physical pain. People with chronic pain who practice mindfulness meditation report less severe pain and pain related distress when they practice relating with their pain in a mindful way. Now, I mentioned the idea of being as specific as possible before, and that tends to be easier when we're looking at things around us. Um, it's also helpful to be as specific as possible when we are trying to identify our emotions. The English language is not as robust as some other languages in how it describes feelings and emotional sensations, but there are lots of words for it. And one of the things that we can do to help us build better relationships with our feelings and more mindfully relate with them and come to a place where we can observe them without judgment and therefore not get swept away by them through an amygdala hijack, um, is we can notice when they show up and identify them as specifically as possible. That kind of helps to put us into the third person point of view in relationship to our emotions, where we're watching them happen instead of really being swept away by them in the moment. So there's a number of free emotion wheels available on the internet. If you type in the term emotion wheel, you'll find many, many samples. This particular one is available for free from UCA, which is a college, university. But like I said, there's lots of different ones. And so if you don't care for this one, uh, doing a little research, you'll find many, many more. And if you are currently talking with a counselor, I'm sure they can help to connect you with a printed out version as well. And so an emotion wheel is a terrific tool for journaling as well, which we'll talk about in a moment. But um, I want to invite you, this is an opportunity in that self-care toolkit to include an emotion wheel as something to reference as needed. And the way that it works, um, for those of you who may not know, is you start in the middle and you identify the closest kind of bucket to what you're feeling in the moment. And so in the middle here, we have surprised, bad, fearful, angry, disgusted, sad, and happy. So for me, I'm feeling pretty happy right now with all of you. And so once you identify which bucket, you go to the next layer, the next outer layer. So we're in the second layer now, where the words get a little more specific. So for me, I am uh, feeling a bit optimistic right now. And then you go to the third layer and you see there's two other options for optimistic to help really drill down into how you're feeling. Hopeful and inspired are the two other options here. Now, sometimes you'll look at this and say, well, that's not really what I'm feeling right now. Well, guess what? That challenges you to think of another word. You know two that aren't it. And so it's a helpful for the thought exercise of trying to expand our vocabulary around our emotions and how we interact with them. All right, so grounding is a mindfulness technique that is designed to immediately connect us with the present moment. And a little bit of science here, the nervous systems are actually involved in this situation, right? So the sympathetic nervous system is responsible for directing the body's rapid involuntary response to dangerous or stressful situations. A flash flood of hormones, it boosts our body's alertness, our heart rate, sends extra blood to the muscles, and prepares the body for action. This is what is triggered during that fight, flight, freeze response and is often tied in with cortisol. Now, the parasympathetic response system does the opposite. It works to calm our bodies down, to conserve energy, and to restore the nervous system to a more relaxed, neutral, and efficient state of being. This is the part of the nervous system that is turned on. You can think of it again with those volume switches. So the volume on the sympathetic nervous system is turned down when we're practicing mindfulness, and the parasympathetic response system's volume is turned up. It's calming the body, conserving energy, restoring the nervous system to a place of safety. Okay. So it grounding not only stimulates the parasympathetic response system, it moves our focus from our thoughts, which may be swirling around and very unwieldy. It removes our focus from there to the here and now, which reinforces a sense of safety for our brain and for our body, and it reduces our feelings of distress and anxiety. Dr. Sarah Allen writes that grounding basically means to bring your focus to what is happening to you physically, either in your body or in your surroundings, instead of being trapped by the thoughts in your mind that are causing you to feel anxious. It helps you to stay in the present moment instead of worrying about things that may happen in the future or events that have already happened. But you so I'll stop it there, but as you can see, this is about a 20-minute video. And it is a good watch. It's called This Is Your Brain on Nature, and it's by National Geographic for anyone who is interested.
I spend most of my day.
Here we go. So, as they mentioned in the video, the brain, we don't even like obviously being out in nature is a great way to bring our cortisol levels down. And so, from the viewpoint of trying to help ourselves manage our cortisol levels actively, getting outside and into nature is going to be a great way to do that any way we can. Um, if in, you know, throughout the day we aren't able to get outside though, or have access to a window, just having a photograph or an image of a nature scene can still be helpful and positive. And so, an opportunity for our self care toolkit is I want to invite you, you know, find a picture that you really enjoy of a nature scene. This could be one that you took, perhaps, or someone gave to you. It could be of one of your favorite places, or maybe it's a postcard that you purchased or were given along the way. Whatever it may be, add that to your self care toolkit so you can pull it out when you need to help bring those cortisol levels down. Movement is another grounding opportunity. It's something called mindful movement, especially. And mindful movement happens when we pay attention. Imagine that. When we pay attention to what our body is doing. I can't tell you how many times, I get from point A to point B, and I didn't even really pay attention to it happening, right? I think that's a pretty common experience, especially when we're busy. Um, so mindful movement comes in when we pay attention to our breath, we feel our body moving as it moves, and we notice our surroundings as well. And this can be done during activities such as stretching or walking, or you can pause and just move in order to practice mindfulness. And so I'll invite us to do a brief example of that now. Um, you know, the hands are a great place to start. So I want to invite you to open up your hand. And as you do so, right, and you're holding it open, notice what it feels like to have those muscles kind of stretching right now. And then I want to invite you to close your hand slowly and feel it along the way. For me, I notice my finger joints are a little creaky as I'm doing it. I didn't notice that earlier today. And give it a squeeze and do it again. We'll do that 2 more times. And notice the movement, notice the sensations in your bones and your ligaments and your muscles as you're moving and doing this. This is mindful movement. All right, so a couple opportunities for our self-care toolkits. In order to aid us in this mindful movement, we could include a stress ball or any kind of, if you've heard the term fidget before, any kind of fidget device um, can be helpful. Perhaps you don't have a fancy one, a pipe cleaner or chenille stem will work just as well. Um, a rock or hand lotion can be an opportunity for a mindful moment as well. Really applying it and feeling the lotion as you move your hands and do that application and as it soaks in, just really pausing and focusing on the sensation of applying lotion. And if it's scented, right, that's another component to really focus on in that moment as well. Journal writing is another opportunity. Research tells us that 47% of patients with a chronic health condition experienced improvement in their physical and emotional well being after writing honestly about what's impacting their lives. Regular journaling acts as a stress management tool and therefore strengthens our immune systems. And so when we journal, I already talked about the emotion wheel. That's one tool that we could use to help guide our journaling. Um, but we could pull it out when we need it, right? That kind of like a emergency, like, oh, I need to get this out kind of situation. Or you could keep a journal and set time aside each day to reflect. What exactly am I struggling with right now? What's going well? The 8 dimensions of wellness could be a helpful tool to think about. So maybe I'm doing really well emotionally and spiritually, but physically, not so much. Or financially, I'm good in all the other buckets. Um, or maybe I have a relationship that I'm struggling with right now socially and everything else is fine. But these 8 dimensions of wellness can help us to kind of think about the different areas in our lives that may be beneficial to write about and help us process. But it's also important for us to write down what's going well. Gratitude is such a powerful tool, and the more we practice it, the more it also activates that part of the nervous system that helps us to calm down and lower our stress levels. So lots of different types of journaling to choose from. I invite you to start with what you enjoy. There's no point in doing it if you don't like it. And so in that self-care toolkit, having a pen and a small journal is a great opportunity as well. All right, so we're coming up to our last couple minutes here, and I will leave you with one more exercise. And this is called a body scan. So the body scan is basically an opportunity to focus your attention on one part of the body at a time, to notice the physical sensations in that part of the body without judging or reacting to them, And you could do this from a seated position, from laying down. Sometimes I do it when I'm standing in line at the grocery store. It's really just an exercise of focusing attention. So I'll walk us through a brief body scan now, just so you can give it a try. So let's start with the top of the head. I can't tell you the last time I stopped and felt the top of my head. But if you need to give it a little touch to kind of bring your awareness there, that's fine. Let's bring our attention to the top of the head. And then let's move down and kind of notice the forehead and our eyes. Are your temples tight right now? Are they loose? Any sensations that you're noticing? Just notice them, no judgment. And we'll move down to the ears, then around the face to the nose and the lips and the jaw. And we'll go down the neck to the shoulders. How are your shoulders right now? Are they loose? Are they kind of up or down? And if you notice they're in a place that could be more comfortable, feel free to move them around a little bit. And from the shoulders, let's go down to the belly. Again, noticing any tightness or relaxation going on. From the belly, we'll go down to the hips. If you're sitting, feel your weight in the chair, perhaps. And then we'll focus on the left leg. We'll go down from the hip to the thigh and the knee, down the calf to the ankle, all the way to the toes. Give them a little wiggle to really solidify your attention there. And then we'll go back to the belly and do the next leg. Down the right leg to the knee, down the calf to the ankle and the toes. I'll invite us back to the room. So the body scan is something that you can, like I said, do at any kind of place. You can do it with your eyes open, your eyes closed. We did a pretty quick version of it, but you can also slow it down, right? If you really want to take your time and, we could do each toe individually. We didn't even really focus on the fingers or anything like that. And so you can make it fit into whatever amount of time you have. But I've gotten great feedback that this is a really helpful tool, not only around reducing stress, but if you're someone who perhaps struggles to fall asleep at night, the body scan can be a really helpful exercise for transitioning into sleep as well. And with that, I believe we are at 12 o'clock. So I will pause there. And thank you very much.